is joined by Professor Christian Mehl, a leading London prosthodontic specialist. Today, we're discussing dental implants, and it can sound like a nerve-wracking process. So today, we'd like to know whether it's safe, effective, and most importantly, painless. Let's find out more about the process. Good morning, Professor Mehl.
Good morning. Pleasure to have me. Thank you very much.
No problem. It's really nice to see you.
Pleasure all mine. Thanks for having me.
Great. Could you tell us more about yourself and your work?
Sure. I'm a dentist previously based in Munich and in London. Now, having sold my business in Munich, I'm solely focused on London, and we're based in the lovely medical clinic of 3 and very soon 5 chairs, where we do general dentistry, implants, prosthodontic work, crowns and bridges, and so on. And yeah, I'm just enjoying myself to be a dentist in this lovely area with fantastic patients.
Fantastic. So let's get started with the questions. What's the main advantage of dental implants?
Well, the previous centuries, I may say, implanting teeth has just been a remote dream. It has always been attempted for already 6,000 years, but we've been actually restricted to base our work either on existing teeth or on just build it around the gums. So with dental implants, we actually are now allowed to recreate artificial roots and can base restorations on these artificial roots. That means a lot of patients have no need anymore for removable dentures, but can have fixed teeth again. And that's just, with regards to oral health related quality of life, it's just for the patients an absolute fantastic achievement and actually a game changer in dentistry.
Great, that sounds amazing. So is the dental implant process a difficult one to go through for patients? And what's involved?
As always, with a simple question, there's not a simple answer really, because if you have plenty of bone left, yes, then the implant procedure is very, very simple, takes 10 minutes, and then you have the artificial root in the bone in place. However, when there's extensive bone missing, you, in some circumstances, need to recreate the bone first, and then 3-4 months later can then place the implants. However, implantology has changed a lot in recent years, I might say. And so at the moment, we strive to, if teeth need to be extracted, that we extract teeth, place the implant, and do bone augmentation simultaneously, just to reduce the patient discomfort. And key for implant placements is always the planning of the operation in advance. So a 3-dimensional X-ray, a digital scan, and photographs to just really evaluate the case before you enter the operating theater.
Great. So what are the risks associated with having dental implants?
Every medical procedure has a risk, but implants is of course one of the safest. We have success rates over 10 years of between 97 and 98% of the implants staying in place, and the 50% survival rate is actually 20 years. So implants have been a fantastic addition to dentistry, and patients benefit greatly for that. But of course, when you do the implant operation, depending on the extent of the operation, you always have bleeding, swelling. You have a 2% risk of inflammation. In the upper jaw, you have the upper sinus. That's a cavity above the teeth, which you might injure, which is not really a great problem. And of course, in the lower jaw, you have a nerve, which you shouldn't touch. Otherwise, you have a very small part of the lip being numb for actually the rest of your life. That's why when you place implants, you should always be aware of these anatomical structures and leave them intact.
Okay. And so does it hurt for patients, or do they have painkillers, or what happens?
Every medical procedure needs to be planned, and is actually nowadays planned with standard operating procedures. So what we do here, we give the patients either 400 or 800 grams of painkillers before, mostly ibuprofen, then a 2-gram penicillin, and if they have a penicillin allergy, something which couldn't replace the penicillin, and they have a mouthwash that reduces the infection risk significantly. And of course, they have local injections or sedation additionally when we place the implant. So the implant procedure itself is completely painless. Now, even if you're awake, you will be able to feel that we do something or hear the noise that we do something, but you won't have any pain at all. And of course, we have a special painkiller regime and antibiotic regime after the implant operation. So funnily enough, even with massive operations where we treat both jaws with many implants and big bone augmentations, interestingly enough, we have patients, most of them report that they don't have any pain at all. Swelling, yes, but no pain.
Okay, fantastic, thank you.
My pleasure.
Are dental implants permanent?
I have been asked this question many times. I implant for life. And actually, implant manufacturers give now lifelong warranties for the implant itself, because they know that means this artificial root. Of course, we as dentists can't do that because everything in the mouth is subject to wear and tear. That's normal because we use it every day, and implants can fail as well. Our natural teeth can fail and implants can fail. Like I said, initially, you have around 1% failure risk per year, around that for the first 10 years. And then the failure risk increases a little bit. And you have around 70 to 80% of the implants are still in place after 20 years. And of the restorations on top of the implants, around 50%. So yes, implants do fail. And the key, whoever listens here, the key to keeping the implant for as long as possible is regular visits to dental hygiene and good oral hygiene at home. If you do that well, you keep your implant longer.
Fantastic, great. And the final question, are having dental implants worth it and why?
That's actually very simple. For us dentists, of course, it's great. We drill a hole into the bone, place something new, and create a new tooth. That's a dream coming true. For the patient, it is always to see if you're very young, between 15 and 30, you might consider other adhesive options where you don't destroy tooth material, like, for example, the front adhesive bridges and so on. Then in between the age of, let's say, 25 until 60, 65, 70, dental implants are fantastic because they give you an option to restore teeth without having to drill down neighboring teeth. And when you then come to the later stages of your life, between 70, 90, and 100, you actually can become more aggressive in drilling down teeth again, because you have then similar long-term survival rates of implants and bridges, for example, and that saves you the surgery. So for patients, implants can feel after a couple of months like natural teeth, and it gives them the pleasure of having fixed teeth. So having to remove dentures in the age of 45 or 50 when you're in the prime of your life is it can be a thing of the past. So for the patients, implants absolutely beneficial because it gives you this oral health related quality of life.
Great, fantastic. So that's it for today. It's been great speaking with you, Professor Mehl. It's been fantastic. And if you're looking for expert dental implant treatment, visit Professor Mehl's Top Doctors profile at topdoctors.co.uk.
It's really my pleasure being on today, and thank you very much for your kindness and the wonderful questions. Have a lovely day.